25 minutes before 8 here on this Monday morning. Good to have you with us. So, as we all know, on Saturday night, President Cyril Ramaphosa said that all indications are that South Africa has reached the peak and moved beyond the infection point of the curve. What exactly does this mean to most of us as we enter level 2 of the lockdown? More industries will be opened, learners are going back to public schools in a week from now, and that our lives will return to, I suppose, a new relative normal, or will they? And what is the latest information on this particular novel coronavirus? So we've got with us Professor Glenda, who is the CEO of the South African Medical Research Council, as well as a member of the Ministerial Advisory Committee, to help us get through all of this. She, of course, is also a pediatrician. Good to have you, Prof. Thanks again for your time.
Good morning.
So hearing that we're going to level 2, I mean, I imagine you were behind the scenes during all of this. So a good move for South Africa. I mean, I think a lot of people saying, right, it's about time we start opening the economy up.
Yes, I think we're very excited. When we started to see the death rates come down and we started to see the easing of the beds in the hospitals, we were very hopeful that we were moving to a next phase of the epidemic. We're now in what we would call the endemic phase, where the infection will grumble on, and that's why we have to be vigilant, because we don't want a second wave or a surge.
Yeah. So let's dwell on that for a little bit in terms of the numbers and the drop in the numbers that we are seeing lately. Some people are attributing it to the fact that there is fewer tests being done. At one stage we were seeing 46,000 tests, then we got down to about 10,000. I think yesterday was about 22,000, and obviously there will be less infections. But talk to us about the testing versus the results.
So we have a specific testing strategy at the moment, and when there was a shortage of tests at a global level and at a local level, we prioritized testing, and healthcare workers, essential workers, and people who were at hospital more likely to be tested than anyone else. And so now I think what has to happen is we have to now change back to community-based testing, start to look at hotspot testing, and start to try and unravel community transmission. And so we are under testing at the moment, but that's because we need to adapt our testing strategy to the level, to the stage where we are in the epidemic. And so it is very appropriate to have that testing strategy during the time when we had a huge medical surge. And so it's time now to start to track community transmission.
Yeah. Also, when we take a look at the death toll, there's a lot of talk as well that the real death toll is not in this number, that it could be in excess of 20,000 more than what we have. So what some theorists are saying and experts, I was reading something today where research was pointing to the fact that it could be around rather a 30,000 mark as opposed to the 11,000. What are your views on that?
So we are looking at excess deaths, and the South African Medical Research Council has for 30 years tracked mortality every week. And when you are in an epidemic or a pandemic like we are in, you will see deaths related to COVID, and you'll see what we call collateral deaths. People are scared to come to the hospitals. Hospitals will get reorientated towards COVID. People may not know that they're ill with COVID and not get to the hospital. We know that you can rapidly decompensate with COVID. So by the time you get to the hospital, you may have already died. And so every death in an epidemic is important and should be counted. And we do estimate that some of the deaths, the collateral deaths and the excess deaths, may be due to COVID, and others are because people are just not getting to the health service for lots of reasons. And so we do think that of the 33,000 excess deaths, some of it is attributed to COVID and some of it to other conditions.
And also, you know, the issue of now going forward and actually testing the deceased. Everybody on their death certificate needs to have been tested, and I know that that's something that it's now going to be rolled out, or there's talk of it being rolled out.
Yeah, it is challenging, and we have to know how many people are dying from COVID-related deaths who are not getting to the health service, because it'll also help us reorientate our messaging and try and help us manage people to get to the hospitals quicker. So it's important to know how many people are dying without knowing that they are COVID positive. We also saw in the beginning of the epidemic that doctors weren't correctly filling in the death certificates. And so we might have underclassified or underestimated COVID deaths because you might not know what a person died of. And so you might put cardiac failure instead of COVID-19 or suspected COVID-19. So it's very important for us to fill in our death certificates properly and also to try and estimate how many people are dying from COVID who weren't tested before.
Yeah. Let's talk about the novel coronavirus now and what we've discovered going forward, because most of us obviously thinking it's a respiratory disease and if you survive it, you bounce back. But studies are showing that it is actually a vascular disease that gets into the bloodstream. What does this mean and how has it evolved in terms of the thinking from the original outset to where we are now?
So COVID-19 is a multi-system, a multi-organ disease. So it goes beyond just our lungs. So in the beginning of your infection, you have what we call your viremic phase, when you're symptomatic, you're flu-y. You then have the pulmonary phase, where you have a lot of pulmonary or respiratory systems. You're breathing fast and you're coughing, and you might have a picture that looks like pneumonia. And then we have the third phase, which is the inflammatory phase, which is the most dangerous phase, and that is where multi-organs of your body get affected. So it's your heart, it's your kidneys, it's your gut, and so every system is affected, and see things like heart failure, myocarditis, cardiomyopathies, kidney malfunction, and so every organ that you have is likely to be affected in the inflammatory phase of the infection.
What is it that it affects somebody in one way where literally they have something like the sniffles or they're asymptomatic and they just get over it so easily and so quickly and there's no problem, and then there are others that really struggle this, and it's not even an age thing, because those ages are varying from patient to patient?
So it's a combination of the age that you acquire it, also obesity, hypertension, diabetes, even underlying cardiovascular disease will make you more predisposed or vulnerable to having a severe infection. Also, the amount of virus you're exposed to can also impact on the course of your epidemic. And so all those combinations, plus there probably host and genetic factors that we still haven't really understood yet that may make people more susceptible. So it's important, so that's also why implementing non-pharmaceutical interventions is important, so that you minimize the exposure, you minimize the amount of virus that one is exposed to. And that's also why it's important to have good ventilation and to avoid congested areas, because that all helps you minimize the amount of virus you're exposed to, which may help you in your course of disease.
Yeah, and as we have heard from the beginning, wear a mask. That's the perhaps the one thing that can help you and minimize the exposure to the virus. Sanitize, avoid these places, good ventilation. I mean, these are the things that you're talking about when we say minimize the exposure.
Yes, these unfortunately are our only tools. They're tools that are about 100 years old, but they're the only tools we have. Our masks, washing hands, keeping our distance, making sure that we have uncongested, uncrowded, well-ventilated areas where we meet people. So it's important. Until we have a vaccine, we're going to have to use these old tools, but they're very important, and they do help with the onward propagation of the virus.
Yeah. Prof, we've seen so many people that do get it, and they're feeling bad for about 10 days, and then they seem to bounce back and they're okay. There are others that take such a long time to recover from this because of everything you explained before, the other organs that have been affected due to this. The recovery time on the coronavirus, what are we looking at?
I think it does depend again on your inherent states of health, how healthy you were, the exposure, how much virus you got exposed to, and whether you have any underlying conditions. But even your average healthy person can sometimes have a lot of fatigue, a lot of tiredness, a lot of aches and pains, even after they test negative. So as I said before, it's a multi-organ disease, and so there are ramifications for you as you try and recover from your infection. And so some people bounce back, some people don't even know that they had the infection, and others really struggle to get better and have to take a lot more time to recover.
Let's have a look now at the infection rate here in South Africa, and it's been a talking point for a while. The fact that South Africa got into the top 5 in the world in terms of the infection rate. Obviously, there's a link between us testing, but there are other countries that are testing more than us. But the reality is that we are up in the same category as countries like the USA, who have a population of 331 million people, Brazil 212 million, India 1.3 billion, Russia 145 million, and then there's South Africa with 60 million, and we're up heading towards 600,000 cases of the infection, that of course being a total. What happened? Why did this spread so fast, and is it spreading so fast in South Africa?
Well, I think that is the moment you get community spreading, we live in overcrowded households. We use a lot of taxis, so we commute a lot. We commute in overcrowded taxis. We live in overcrowded areas and in congested communities, and so it's very hard to contain the transmission when you have those kind of conditions. And so what we saw in South Africa was the fact that people use public transport and they live in congested areas, and it's very hard then to contain the epidemic. And so that is why we saw such increase in numbers. And that's the same as Brazil. So Brazil has the same kind of demographics as we have, a lot of overcrowding, a lot of people who use public transport, and that really drives the epidemic in low middle income countries. You probably also see that in India, that in amongst the congested areas and people using public transport, again, high rates of community transmission. And so it's probably a combination of our demographics as well as the conditions that we live in that make us more susceptible to having this community transmission that's very hard to control.
Yeah, and we also need to be very aware of the fact, we heard the president saying that the country is opening up and, a lot of industries are allowed to operate now, whether we're talking about bars and restaurants and interprovincial travel and tourism, all of that is now allowed. But gyms even are allowed to operate. Obviously, the rules are going to be coming in, and we'll hear this. But, the disease is still there, and people need to understand this, that it's not... This is more of an economic reason that we have to get this country going. We've got to revive it. But this is still there, and we could still see these surges. I mean, you talk about a second infection. We've seen many other countries around the world going through this and then re-entering a lockdown because they loosen up on their behavior. Some are skeptical that South Africa will go in that direction. But what are your views? Do you think we may see a second rise in infection if we do not stick to the behavior that we've been told to?
Well, that's what I'm worried about. Already we're seeing in Europe an increase in infections amongst young people. So in France, Belgium, and in Netherlands, you're seeing that young people who are in their 20s are getting infected at this moment in time. And that's because they have infection fatigue, and so are stopping to use their masks and going to crowded bars and clubs and non-pharmaceutical interventions. And when young people spread the infection, obviously old people are susceptible, and so people have to be mindful. So you prevent your infection, so you don't infect older people in our society or our older citizens. And so it's very important for us to continue to be vigilant. We're going into the endemic phase of this epidemic. We will continue to have community transmission. We'll continue to grumble along. But how bad it gets depends on us as citizens in this country, depends on our ability to continue to wear our masks, wash our hands, and keep distances. Yeah,
certainly. I mean, you mentioned just a few countries, and the list is quite endless in terms of the reinfection rate, whether we talk France, Spain, Norway, US, Belgium, Hong Kong, Australia, New Zealand. I mean, it's happening. So, we need to be very, very vigilant. But we sit with a recovery rate of 80% from what the president did tell us. When we talk 80%, people think, well, I'll just get it and then I'll move on. But this is something that a lot have been asking. I mean, if there's a recovery rate of 80%, why are we taking this so seriously? I mean, this is just a normal virus that we can just get on with life. We should have got on with life a lot long ago if, in fact, this is what the recovery rate looks like.
Well, for lots of people, the infection will be asymptomatic or mild. But for a group of people in our country, it will be devastating, and And so we know people with comorbidities, diabetics, hypertensives, people who are obese and are elderly will die from this disease. And we've already seen a tremendous amount of people dying. We've seen our hospitals buckle under the pressure. And so this is no party. This epidemic. For some people, it's a mild disease, but for a big portion of the population, it's a devastating disease. We have lots of obesity in our country. We have hypertension and diabetes, and that does affect the progression of disease. Mm-hmm. And so, while for some people you may have an asymptomatic disease, the person you transmit it to may be the person that dies. And so we have to be careful and mindful of our population. We're all citizens of this country, and we all have a responsibility not to make anyone else ill. So even if we might have an asymptomatic illness, we need to protect our elderly, we need to protect our grandparents, we need to protect the old people in society and those with comorbidities. As I said, there's a lot of comorbidities in this country, and we don't want people to get ill because we are not mindful.
Yeah. Two more quick questions to you, Prof, before I let you go. Schools. Now, I know that you're a big advocate for getting kids back to school and saying that the schooling needs to resume. We need to get there. Do you think that, in a way, the President should have actually cut short the break? Because if I'm not mistaken, we're seeing public schools only going back next week. But with the country opening up tomorrow, why not just get schools going? Or is there obviously the Ministerial Advisory Committee that will play more of a role in this decision? But schools going back?
Well, hopefully the schools are using this time to get ready and preparing for their classes and preparing their students. We've seen that we need to de-risk the classroom and de-risk the school. We need to address the concerns that teachers have and try to understand their reluctance to open up the schools. So I think it's an important process. Yes, it would have been nice to have the schools open this week, and maybe there are things that have to happen that make prepare. So hopefully this week the teachers are preparing. They're going through their processes. They're learning how to implement non-pharmaceutical interventions, and they're making sure that their classes are ready to receive the pupils who need to come back to school.
All right. Final question to you. I know that you participated in the vaccine trial that's currently underway here in South Africa. There are many vaccine trials taking place around the world. We've spoken, I spoke last week about the Russian vaccine. That's the first country by the President to give it the thumbs up there, Vladimir Putin. But in terms of vaccine trials and in terms of finding whether it be a cure or some kind of a tool to fight this, how far away are we? And are you confident in this Russian vaccine, or is it a bit too soon, in your opinion?
Well, we need to see the data. So in any vaccine program, you need to see the data from humans. You need to see the preclinical data, the data from non-human primates. And so without evidence, it's hard to say whether the vaccine works or not. And that's what's good about South Africa. We have a very good regulatory authority. And so if you wanted to register a vaccine in our country, the regulatory authority would look at the data, look at the efficacy, and look at the safety. So, without that kind of information, you would be it would be reckless to register any vaccine or any drug in our country without having data. I do believe that there are lots of vaccines that are going to be effective, and the more vaccines that are effective, the better for us, because that will drive down the price of vaccines. And also having lots of companies scaling up their production means that every country can have access to vaccines. And so we've had to concertina all the work that we do. Normally it takes 10 years to develop a vaccine, and we've had to put 10 years into 10 months. And so hopefully towards early next year, mid next year, we'll start to see the results of these vaccine trials come through, and hopefully we can register a vaccine in an expedited once we have that these vaccines work.
All right. Thank you for talking to us here on the program. That was Professor Glenda Gray from the South African Medical Research Council discussing with us lockdown level 2, schooling going back, figures coming out in South Africa, as well as many other issues, including a vaccine. So again, thanks very, very much for your time. All right, we're almost running out of time here on SABC2. Remember that if you want to continue watching Morning Live, we do go on for another hour on SABC News.